In Lesson 4, we will learn the third element of medical decision-making, called risk. We will understand how providers assess the risk of complications, morbidity, or mortality associated with patient management. We'll also discuss the 4 risk levels: minimal, low, moderate, and high. Before we begin, this training is for educational purposes only. Always refer to the latest CPT, ICD-10CM, HCPCS Level 2 manuals, payer policies, and official coding guidelines when assigning medical codes. In this lesson, we will focus on the risk element of medical decision-making. You will learn how patient management risk affects EM code selection, understand the different risk levels, minimal, low, moderate, and high, and apply these concepts correctly during medical coding. By the end of this lesson, you'll be able to identify the appropriate risk level using CPT EM guidelines. Medical decision-making, or MDM, is the process physicians use to evaluate patient information and choose the most appropriate diagnosis and treatment plan. For EM coding, MDM is based on 3 key elements: the number and complexity of problems addressed, the amount and complexity of data reviewed, and the risk of patient management. In this lesson, our main focus will be on the risk element. CPC exam tip. Remember the MDM formula: COPA plus data plus risk equals MDM level. Medical decision-making has 4 levels: straightforward, low, moderate, and high. These levels are determined using 3 elements: the number and complexity of problems addressed, the amount and complexity of data reviewed, and the risk of patient management. According to the CPT guidelines, only 2 of these 3 elements need to meet or exceed a particular level to assign that MDM level. This is known as the 2 of 3 rule, and is essential for accurate EM coding. CPC exam tip. Remember, 2 out of 3 elements equals final MDM level. This is one of the most frequently tested concepts in the CPC exam. The risk element in medical decision-making reflects the complexity of patient management. It considers the risks associated with diagnostic tests, treatment options, and management decisions. The physician evaluates both the treatments selected and those considered during shared decision-making with the patient. Decisions such as hospital admission or outpatient management also contribute to the overall risk level used for EM coding. CPC exam tip. Risk is determined by the physician's management decision, not just the patient's diagnosis. In medical decision-making, risk refers to the likelihood and consequences of patient management decisions. Physicians classify risk as minimal, low, moderate, or high based on their clinical judgment. Remember, CPT guidelines focus on the risk associated with the treatment or management options, not simply the patient's diagnosis. Decisions regarding additional testing, treatment, or hospitalization all contribute to determining the overall risk level. CPC exam tip. Always remember, MDM risk equals risk of management decisions, not the disease itself. This is a commonly tested concept in the CPC exam. In MDM, surgical procedures are classified as either minor or major. They are also categorized as elective or emergency based on the urgency of the patient's condition. Elective procedures are scheduled in advance, while emergency procedures require immediate or urgent treatment. Remember that both minor and major surgeries may be performed either electively or in an emergency setting, depending on the clinical situation. CPC exam tip. Do not confuse procedure size with urgency. Minor versus major equals type of surgery. Elective versus emergency equals timing of surgery. Medication management is an important factor in determining MDM risk. Over-the-counter, or OTC, medications can be purchased without a prescription. Prescription medications require authorization from a healthcare provider. Controlled substances are legally regulated because of their potential risks. The type of medication prescribed and the level of management required help determine the patient's overall risk level for EM coding. CPC exam tip. Remember, OTC medication right-pointing arrow usually lower risk. Prescription drug management right-pointing arrow often indicates moderate MDM risk. Controlled substances right-pointing arrow may increase the overall risk depending on patient management. Some medications have the potential to cause serious side effects and therefore require intensive monitoring for toxicity. The purpose of monitoring is to detect harmful effects rather than to measure how well the medication is working. Monitoring may include laboratory tests, physiologic monitoring such as ECG or pulse oximetry, or imaging studies. Drug therapy requiring intensive monitoring is an important factor when determining the MDM risk level. CPC exam tip. Remember, prescription drug management equals usually moderate risk. Drug therapy requiring intensive monitoring for toxicity equals high risk in MDM. Social determinants of health, or SDOH, are social and economic conditions that affect a patient's health and medical care. Examples include lack of housing, food insecurity, transportation problems, financial hardship, or low health literacy. These factors may limit treatment options, delay care, or reduce compliance. In MDM coding, documented SDOH can increase the overall risk level when they significantly affect patient management. CPC exam tip. Remember, documented SDOH that impacts treatment or management equals moderate risk in MDM. The social issue must affect medical decision-making, not simply be mentioned. This slide highlights examples of social and family situations that can increase patient management risk. Patients with financial hardship may not afford medications or treatment. The death of a family member may delay medical care. Children in foster or welfare custody often require additional education and coordination with caregivers. When these factors significantly influence medical decision-making, they should be documented as part of the MDM risk assessment. CPC exam tip. Remember, social or family issues count only if they affect patient management or treatment decisions. Proper documentation is essential for assigning the correct MDM risk level. This slide explains hospitalization decisions in MDM risk. The provider may decide to admit a patient, transfer them to another facility, or escalate care to the ICU. These decisions increase the risk level because they involve significant clinical judgment. Even if the provider decides not to hospitalize the patient after evaluation, it can still count toward MDM risk when the decision is clearly documented. CPC exam tip. Remember, hospital admission, transfer, ICU care, or documented decision not to admit are important MDM risk elements. Proper documentation supports the correct E/M level. This slide explains that hospitalization decisions include evaluating different levels of care, such as inpatient or outpatient management. A documented decision not to hospitalize can also contribute to MDM risk. In addition, simply referring a patient to a specialist does not increase the MDM level. The referral must be based on a documented clinical evaluation, assessment, or examination. CPC exam tip. Remember, referral alone does not equal MDM credit. The provider must document the patient's condition and medical reason for the referral. Hospitalization decisions, including the decision not to admit, may support a higher MDM risk level. MDM risk is divided into 4 levels: minimal, low, moderate, and high. The provider selects the appropriate level based on the patient's treatment, medications, procedures, and overall management. Understanding these categories helps assign the correct E/M code. CPC tip. Remember the 4 risk levels: minimal right pointing arrow, low right pointing arrow, moderate right pointing arrow, high. High-risk MDM includes situations where the patient has a significant chance of serious complications. Examples include intensive monitoring for toxic medications, decisions regarding major surgery, emergency surgery, ICU admission, controlled substances, or end-of-life care decisions. CPC tip. Hospitalization plus major surgery plus intensive monitoring equals high risk. Moderate risk commonly includes prescription drug management, elective major surgery without identified risk factors, minor surgery with patient risk factors, and social determinants of health that affect treatment decisions. CPC tip. Prescription drug management is one of the most frequently tested moderate risk examples. Low-risk MDM includes over-the-counter medications, minor procedures without risk factors, and therapies such as physical or occupational therapy. Minimal risk involves simple conditions requiring little or no treatment and very low-risk diagnostic testing. CPC tip. OTC medications equals low risk. Simple evaluation only equals minimal risk. In this lesson, we learned the risk component of medical decision-making. We discussed the 4 risk levels: minimal, low, moderate, and high, along with common examples such as over-the-counter medications, prescription drug management, surgery, hospitalization, and intensive drug monitoring. Remember, risk is only one part of MDM. The final EM level is determined when at least 2 of the 3 elements, COPA, data, and risk, meet or exceed the required level. Review these concepts regularly, as they are frequently tested in the CPC exam. Thank you for watching, and I'll see you in the next lesson. Thank you for watching this lesson from KS Medical Coding Academy. I hope this session helped you understand the risk element of medical decision-making. Continue practicing the Captain EM guidelines and solve more coding scenarios to strengthen your CPC exam preparation. If you found this lesson helpful, please like, share, and subscribe to our channel. Thank you, and see you in the next lesson.